Hi, everybody, and welcome to our February Ambassador Zoom. Today's guest is Lindsey Gill, my colleague, and she will be giving a state legislation update. And then after that, I will talk about our Kidney Action Summit. And then we will have a question and answer time for all you folks. So without further ado, I will turn it over to Lindsey.
Great, thank you, Ben. I just started sharing my screen and I'm going to be showing a few things and flipping back and forth from a slide and website that I wanted to share with you all, but making sure that everyone can see this all right. All right. Great. So welcome, everyone. So glad to see some familiar faces, some new faces. My name is Lindsey Gill. I am the Associate Director of State Policy and Advocacy here at AKF. I really enjoy speaking at these ambassador briefings. I think it's a great opportunity for us to get to know you a little bit better and you get to know other ambassadors. And I certainly want this to feel like a conversation instead of me speaking at you. So if you feel comfortable with asking any questions, feel free to do so. I always like giving these, what's happening in the states briefings at this time of the year because it's certainly the busiest time of the year for state legislatures. So for those that aren't as familiar with state legislatures and how they work, typically state legislatures are in session, meaning that state legislatures gather at the state capitol to, review and introduce different bills. And they typically do that for only a few months out of the year. And typically they're between January and March, or maybe even to mid-spring. So it's really a sprint to get a lot of these bills across the finish line and to the governor's desk in a really relatively short amount of time, certainly in comparison to bills that move at the federal level. So whenever Ben may reach out to you and ask something of you or want to get in touch with you, it's, if it's something at the state level, it's something that's working very quickly typically. So it's exciting, it's really fun, and I'm happy to share with you all what we're kind of working on right now. But before I dive into each of the states that are active with different pieces of legislation and how you can get involved, there's been some new updates here at AKF, which is very, very exciting for us. There's some new resources that you can take advantage of. As of yesterday, we just launched a brand new website. So if you go and check out our website, and you've been there before, you can see it looks much different. It looks amazing. So we are very grateful for our communications team and everyone else at AKF that was involved in making this happen. For any of the advocacy related content, you can visit kidneyfund.org/act. That's going to be all of the information that you'll need on bills that are happening and you can take part of either at the federal level and the state level. Also on the main page, the Get Involved button that you'll be able to see how you can get involved in other advocacy efforts. A lot of you are clearly some pros here and getting really involved. So wanted to share this opportunity with you on how you can take advantage of the new website. And for those that don't know, we also produce monthly advocacy blogs with updates happening in the state legislature. So that's somewhere you can take a look and see what's happening in the states there as well. I wanted to quickly show you what the website looks like.
Just like that going to my business.
All right, and here we go. So it looks fantastic. These are the different, what we call campaign cards or our action alerts. And you can filter them based on location, the different topics. So if you want to click on a campaign, it's going to share what the petition or take action is. And once you click it, you can enter in your information and send the email to your lawmakers. So this is just a really easy way for you to get involved, and it'll only take a few minutes. So very excited to show you this. The next update and new resource will actually be updating our living donor report card March 16th. So last year we unveiled the living donor report card, and it's a map of the United States that grades each state based on their living organ donor protections and laws that are enacted in each state. So you can see the grade of your state, the protections that are in place, and what potentially needs to be done. So we're going to be updating the report card very soon, so you can see the changes that were made last year and what it looks like this year. So that one is this page, and you can see it's very beautiful and color coded, and you can see who has an A all the way to an F. So just wanted to share those resources with everyone. I think it gives a great baseline understanding of where the protections are in each state currently and how you can take action in your state. Great. So one piece of landmark legislation that I'm sure a lot of you have heard of that we work both at the federal and state level is our Living Donor Protection Act. And so what this legislation does is prohibit life, disability, and long-term care insurance companies from discriminating against people based on their status as an organ donor. I'm sure, as a lot of you know, these insurance companies, can either raise premiums or deny, potentially life insurance altogether, simply based on the status of an organ donor. And we know it's just simply not true that, living organ donors, typically have just as great as quality of life as someone that has, both of their kidneys. So we are enacting this legislation across, all 50 states. That report card, like I mentioned, really shares, where each state is in these different protections. But there's a lot of variety in what these bills can look like. In the second bullet, you can see a lot of them provide job protected leave for the donor. Some of these bills actually include tax credits for the donors themselves and tax credits for employers who provide paid leave. So both.
Lindsay.
Yes.
I have a question. Is this for this, is AKF supporting the Living Donor Protection Act for all patients?
Yes, for all, do you mean in any type of
Yeah.
living organ donor?
Yes.
Exactly, yes. So this will include kidney, liver, bone marrow, any organ is included in the legislation.
Now, would that be all patients insured and uninsured?
Yes, so, well, typically for those that are insured or looking to be insured with these different types of insurances.
Okay. Thank you.
You're welcome. And most recently, we're actually looking to introduce bills that actually provide direct reimbursements of up to $10,000 to living organ donors for expenses that are associated with organ donation, but not necessarily covered by insurance. Some of this can include medication, childcare, things of that nature, to really help financially ease the burden of people that are living organ donors or people that are considering being a living organ donor. So we want to incentivize people as much as possible to make this life-saving treatment. And the states that we're working on with all the different types of different living organ donor legislation is these states below. So California, Florida, Georgia, Illinois, Indiana, Kentucky, Massachusetts, Michigan, Nebraska, New York, North Carolina, Ohio, South Carolina, Virginia, and West Virginia. So a lot of different states, a lot of different types of legislatures, but all of them really see the importance of living organ donation. And if the state that you are in does not, have current legislation pending, that's not to say that it, hasn't passed in the state in years prior. So, for example, Maryland has a lot of protections for living organ donors, and they do have a tax credit bill that passed last year. So a really great way to see where your state stands is, again, that living organ or that living donor protection report card. So a lot of these states you can get involved, and please feel free to reach out to myself or Ben or anyone else on our team to get involved and take action on these bills. But we are hopeful that a lot of these states start passing in the legislature and get to the governor's desk this year. Great. The next major piece of legislation is what we call our chronic kidney disease task force. So this task force, what it will do is bring members of the legislature and members of the public, so patients, doctors, really people that are involved in wanting to curb the rising cases of kidney disease in our country, and ways that we can prevent it. So the idea is to have a roundtable, have collaborative efforts, so we can really, address kidney disease and take it head on. So, the goal is to provide more patient education, awareness, and increase preventative treatment. And members of the task force are really tasked with creating policy proposals for lawmakers and regulators. So once these task forces meet, they can come up with ideas that they can then present to the legislature, perhaps the next session, and get that bill introduced and signed into law. So we're hopeful that in all of these different states, these will pass, and then it will help really reduce the prevalence of kidney disease in that particular state. So this year in Massachusetts, Utah, and Virginia, this bill is pending. The Virginia task force has actually already passed the Senate and is being considered in the House and is in committee today. So, a lot of these bills are moving through the legislature, which is a great sign. The final piece of legislation I wanted to share with everyone is our Medigap legislation. This is a bill that we are working on at the federal level, but certainly know that we can chip away at all 50 states by introducing this in different state legislatures as well. And what this bill would do is this would ensure that patients with ESRD who are able to obtain a Medicare supplement or Medigap coverage if they're under 65 years old. By way of background, it's, some people are surprised by this, but, not all Medicare beneficiaries have access to supplemental coverage in 20 states. Insurers are not required to offer Medigap to ESRD patients under the age of 65. So this is something that is very crucial, to, a lot of patients that need that supplemental insurance coverage. So in those 20 states, we are educating lawmakers and we are introducing legislation and really trying to get it across the finish line. And some of these bills also include premium price protection, which is something that we would actually prefer. So this coverage that insurers offer will actually be affordable for patients. Just because insurers are required to offer it doesn't necessarily mean that it has to be affordable. And typically the premiums are extremely expensive to also have a Medigap plan. So we're really trying to make this affordable and easy as possible for patients under 65 to get this extra, Medigap coverage. So this year it's been considered in Arizona, Kentucky, Rhode Island, Nebraska, and Vermont. All right. So with all that in mind and everything that we're working on, I'm sure you're wondering what ways you can get involved. And there's a lot of ways that you can get involved. And certainly you joining this webinar today is extremely helpful and shows you're really ready to take extra steps to make a difference at the state level. So the first thing, and I know a few of you have already done this, but if you have not already, what you can do is actually sign up for text messages to receive action alerts directly from us. I'm sure some of you here have actually gotten text messages from us asking you to participate in the legislative process and email your lawmaker or tweet at them. And the way that you can sign up, it's super, super easy. All you have to do is open up a brand new text message on your phone. So like you're crafting a new text message to someone. And in who you're sending this to in the to line, the number you're going to text is 52886. And the word that you're going to text is kidney. All one word, no spaces, just kidney. And once you send that text, you're going to get a link back. And if you click on that link, you just fill out your information and you are opted in to receive text messages from us. So if you have any trouble with that, let me know, but it's a really easy way to get involved and stay up to date with what's happening in your state.
And so, Lindsay, we have a question from Kyle in the chat. I don't know if you can see that one.
Let's see. Kyle, the question is, do we have any data yet on the folks under age 65 with kidney failure and how well their Medicare Advantage plans are working or not since enactment last year, or any plans to conduct such a survey data collection? That is actually a fantastic question, Kyle. That's actually something that has been brought up by different legislators, particularly in Nebraska. They've asked, patients are eligible for Medicare Advantage plans, do not necessarily need a Medigap plan, and we know that's simply not true. And having Medigap coverage is essential and making it much more affordable than Medigap, or excuse me, MA plans. Because it's so new, I do not have that data right now. I can certainly ask some members of my team if there is any data available, but I don't believe quite yet, just because it's only been a year and some change since that has been available. But I think that's a fantastic question. Kyle, I'd love to get back in touch with you on that. But certainly something we will look into. That data point is extremely valuable, especially as when we're talking to legislators.
Does anyone else have any questions about state legislation?
In terms of the Medigap issue or legislation, I'm also wondering about how it can, or if it's going to include transplant, because one of the things that I ran into, the roadblock that I ran into was when I first tried to get Medigap here in Maryland. The very first question was actually, and this was care first. The like the first or second question was whether or not my doctor had talked to me about transplant, about organ transplant. And that actually disqualified me. So I'm just wondering if you've making sure that kind of transplant isn't out of the out of the loop with this?
That is a great question. And that's a major reason as to why we want to have states offer Medigap plans, is because if you are not fully insured, as I'm sure you know, if you have a Medicare plan, it only covers up to 80% of costs. So having, the supplemental coverage would actually allow you to be on the transplant waiting list if you were, if you have a Medigap plan. So that is certainly the goal of having the supplemental insurance with Medigap. So yes, you would be able to then be on the transplant waiting list if you have that supplemental coverage. So that is certainly a key component of why we are pushing this legislation.
I have a question, Lindsay, before you leave. It's Tamara. How are you?
I'm doing well, Tamara. How are you?
Well, I want to know about Georgia. Talk to me about
Yes.
the giving, what is it, giving of the
Yes.
Gift of Life Act?
It is.
Talk to us about that.
Absolutely. So for all my Georgians here, yes, the Giving the Gift of Life Act. So it's essentially our Living Donor Protection Act, which includes, most all of those provisions and even the tax credit provisions. And Senator Albers himself, who is the sponsor of the legislation, is a living organ donor. He donated his kidney to his son last year. So he's been a great champion at pushing this bill. It has passed the Senate and is currently in the House Ways and Means Committee. And this bill is in that committee right now and has not yet been scheduled for a hearing. But once it does, and presumably passes that committee, it will then go to the House floor and presumably will pass there, and then will go to the governor's desk. So it's, made quite, it's gone quite a ways in the legislature. I would say there's only a few more hurdles left. I am feeling very confident and good about the bill making its way to the governor's desk this year. So the more that, the chair of the House Ways and Means Committee, hears from constituents that, that we want to hear the bill is extremely important. So that is something that you can certainly do in Georgia if you live there, just to reach out to, both your own state representative and the chair of the House Ways and Means Committee.
Yeah, Tamara, I know that in the past 6 months, the Braves won the World Series and Georgia won the college football title. But when this passes, this will be the most important thing to happen in your state.
This will certainly be the best victory.
Yeah. Yes, indeed. And we're ready for it.
Yeah. I see Kyle put his virtual hand up.
Hey, Lindsay, it's Kyle. Quick question. Your previous slide looks like it was pertaining to Illinois and insurance coverage. Can you go over that for me again? What's our status there for Illinois and what needs to be worked on? Thanks.
Yeah, so the living organ donor legislation, this is actually a tax credit bill. I can share the information with you after, Kyle. It seems like, from what I understand, in Illinois, the budget is really the biggest priority in the state right now, and that's really what legislators are zeroed in and focused on. I think in these instances, when these bills are kind of what we consider to be stuck, reaching out to your own representative and senator, and also the chair of the committee where the bill is in, and asking for a hearing on the bill is really the best move at that point in the process, and really just educating your own lawmakers on what the impact of the bill will do. So you've asked some great questions. I'm happy to follow up with you on the bill and who you can talk to.
Yeah, definitely, because I think the Health and Human Service Chair just changed over as well. The Greg was the one that was exiting, or maybe his term's not just finishing up. So, but let me know.
Absolutely.
Thanks.
Any other questions for Lindsey? Okay, so then I will take over from here and just give a, Lindsey, if you can close your
Yes.
screen.
I will do that.
Just give a quick update on Kidney Action Summit for everyone who submitted applications for that. Thank you, everyone. We had quite a bit over 100 applications submitted, which is wonderful. So we're currently going over all the applications. I've reached out to some folks that, for whatever reason, had blank spots in their application. So trying to fill in those spaces, and then I guess I'm also talking to a few folks so far to just learn more about their story, because I understand you can only put so much about sort of your life story just in the application. So reaching out to folks to learn a little bit more about that, and then I think next week we'll be reaching out some more to folks, just because we have such a high number of applications, and what I think is great, a very high number of people who have never applied before. So very much looking forward to getting to know more ambassadors. But for everyone who has applied and has not applied, which is everybody, we are going to be doing a lot of in-district meetings once again. So if you are not selected for the Kidney Action Summit, please don't take it personally. We're limited to about 30 spots, and we try to spread those out all over the country and do a mix between people who have participated before, people who have not participated before, folks who are in, if they're members of Congress, are in different leadership positions, people who their member of Congress have no leadership whatsoever, but just have good applications. So we try to just get a good mix of ambassadors as best we can. But that still leaves plenty of other ambassadors who are not selected, but lots of advocacy to do throughout the year. So hopefully everyone who has applied will continue to be interested in that. So does anyone have any questions about Kidney Action Summit? Going once, going twice. Okay, so if no questions, thank everybody for participating in the briefing today, and hopefully we'll see you around next month as well. So thanks, everybody.